What are the different buttock types and the important relevance for what is possible in a body contouring procedure and what not? Because everybody comes with their anatomy, and what we can do in surgery does, of course, depend on what the patient looks like before. So I'm going to walk you through the different buttock shapes and what we can do with what shape, because it's important to understand your original situation, your starting point, your base, of course, matters. We cannot, surgery is not just like drawing a picture, but we are, of course, we are modifying an existing anatomy, and the shape you have before surgery will determine the shape you have after surgery. That's pretty much common sense. So we're trying to make everybody happy. We try to give everybody the shape they want, but only within the shape they can, of course, because there's important anatomical limitations. And the limitations depend on your shape. So what shapes are there? Just for documentation purposes, we differentiate A shape, C shape, H shape, and V shape. In real life, the borders are sometimes a bit blurry, so it's usually a mixture of various shapes, but this is the four standard shapes that we classify. The V shape, without doubt, is on one side the most challenging to correct, no doubt, but it's also the most rewarding to correct. Because the V shape, that's the inverted triangle shape, this is where the waist is actually wider than the hips. That is something that patients are really bitterly unhappy with. So they're very appreciative, grateful, happy with the surgical outcome because they enjoy the improvement very much. Having said that, when you have a V shape and you want to do a body contouring procedure in a kind of Brazilian butt lift style, you need to know that because the hips are inverted, because they have that V shape, there is a limit of how much fat the surgeon can put, because the skin envelope is a bit tight and there's not so much space to put. So you see here, the V shape goes inwards, and that limits hip expansion possibilities a little bit. Easier is A shape and C shape. If you have that before surgery, we can pretty much go with your flow. So you can say, I want this and I want that, because they're easier to modify. There is more recipient, there is more tissue to graft into, and so surgically that is maybe a little bit easier. However, these patients look pretty good before, so that's not a shape that we see terribly often in primary Brazilian butt lift surgery. We see that in secondary cases who do second rounds, because they have either a round shape after BBL or inverted harp shape, and they might want to dramatize that effect more. That's not uncommon. So this is the more favorable shapes. C shape is something that most of my patients like to call a bubble butt. That's not my favorite terminology, but okay, let's call it that way. And the A shape is the famous inverted heart. Now, the H shape is somewhere in the middle. That's a straight shape, but not inverted hips. And that is kind of in between the other shapes. I would say within our patient community, it's the most frequent preoperative situation that you find. So of all our wonderful results that we share with pride, when you click through the gallery, you see that the majority of patients for first round BBL come with an H shape. It's a very rewarding shape to address, because they respond a little bit better to hip expansion than the V shape, and they often get very spectacular results. So the hip opens up because there's a little bit more tissue to work with. Having said that, again, there's often a bit of a mix. So more important than the actual shape is the fact that in many patients, you can't really judge, because we see a lot of patients who have a kind of roll, an all-around roll of fat in the lower tummy and the lower back and the love handles, and this can completely blur your shape. It could completely masquerade the real form you have. And here in those cases, sculpting the waist by liposuction alone will completely transform the shape before you even put any fat. So you see here, that's I call this the fat ring, and that is fat around the crest of the hip bone, and that can change your shape significantly. You see this case example, I think it's a beautiful case example, one of I think the most drastic ones that I have seen in my practice. Of course, this lady has fat transfer to the buttocks too, no doubt, but you see that about 80% of the very, very dramatic change in shape comes from sculpting the love handles, sculpting the waist pad, which is masquerading her shape. Same thing here. Actually, this patient has a beautiful shape, but it's completely covered by the fat roll and the love handles. And I think it's easy to see in this case example here, there is, of course, a significant amount of fat grafting to the buttocks, but the result, as you can see, comes 80% by sculpting out the waist and uncovering the true shape of the buttock. You see here another case, front view, very, very localized fat deposit here in the ring area. And she has fat grafting to the hips, so we shape the hips, of course, but most of the result you see in this case comes from shaping the waist. It comes actually from liposuction, from removing fat, not from putting fat. So we actually in our daily practice don't so much document in shapes, but what we measure is the waist to hip ratio. That's really our standard of performance. That is our audit parameter. This is how we rate results, how we evaluate outcomes. And so basically what we do, we measure the width of the waist at the height of the iliac bone, of the hip bone, versus the widest point of the hips. And let me walk you through one example. You see the lady here before surgery, waist to hip ratio 1, after surgery, waist to hip ratio 0.7. Then she does a second round and she goes to 0.5. 1 to 0.5 in one session will be very, very difficult. So you see that's an A-shaped base, goes from 1 to 0.7 and wants to tune it up to 0.5. That's fine, but this is for us the more reliable parameter to really measure the result, the outcome, and the body shape. So the takeaway, I think, a great result is achievable for everyone who's got a bit of a fat deposit in that area, where we can get a sometimes enormous improvement of body shape by just reshifting fat. It's not about increasing size or creating big butts. It's about changing shape, accentuating waist, rounding hips. So what you can achieve with this depends, of course, on the look you have before, on your base, on your starting point. And bear in mind, if you have a V shape, there is a high chance you will likely be very happy with the outcome, but you might want to do it again to dramatize the results. So that's the overview. Preoperative shape determines the result, but everybody can have a nice change of shape. So we're looking forward to your pictures for your assessment to give you an insight about what we can do.